We want to take a closer look at something serious. There is a long-standing problem facing hospitals in our state that doctors say is only getting worse. Kids with severe behavioral and mental health issues like violence and bipolar disorder are stuck in psych units in emergency departments. Why? They're waiting for placement in a facility that's meant to care for them for the long term. Those facilities simply don't exist in Maine. And now those families are facing a catch-22. Leave their child in that emergency department or send them to a facility out of state, sometimes thousands of miles away. And Chris, you spoke to one mom who made the difficult choice.
Zach, that mom tells me that her 13-year-old son has a mix of mental and behavioral health issues that cause him to be violent. Violence that she calls life-threatening. For years, she's tried to get him the intensive care he needs. Those emergency department psychiatric units are the only place that would consistently care for him and kids like him when they're in crisis. The doctors there say it's not helpful or sustainable. His mother worries it could be harmful.
It's heartbreaking on one hand.
This mom from Maine is at the end of her rope.
On one hand, you're watching your child struggle with something that you cannot understand and that you cannot reason with. You cannot reason in those moments with this type of illness. On the other hand, it is extremely frustrating to live with that and witness it because there is help.
She has asked us not to reveal her identity. What reveals itself in her voice is the anger and frustration that any parent in her shoes would feel.
There are therapeutic interventions, there are specialists, there are programs that exist for children like him, but accessing those resources is next to near impossible in the state.
Not here.
The only place that would consistently take him in during his moments of crisis was a psychiatric unit in an emergency room.
And it's a type of hell that you can only understand if you've walked through it.
We're just about done.
She's not alone. Kids across Maine are stuck here. Northern Light Health gave us this video inside the psych unit at EMMC. No fresh air, no sunlight, no education, no room to run around.
I watched my child at the age of 9 decay in a cell with no windows. He spent birthdays in that cell in a pair of paper scrubs, not allowed his clothing, not allowed anything in or out.
According to data from Northern Light Health, in 2022, more than 4,200 people, including kids, stayed in emergency departments for more than 2 days.
So the entire time that I've been here, it's been an issue, and it's an issue that just continues to grow.
Dr. Michael Melia is the chief of emergency medicine at Northern Light Health's Eastern Maine Medical Center. He says they have seen patients as young as 5 years old.
We have fewer resources for them, and the patients that we're seeing are staying in emergency departments longer and longer.
Those kids are facing similar challenges, behavioral and mental health struggles that often manifest as violence.
Actually, our most violent patients have often been pediatric patients. They don't know that they're being violent. They're not intentionally trying to hurt somebody or harm somebody, but it's just part of the way that they interact with the world.
State data show almost 900 kids were stuck in emergency departments across Maine for 7 days or more in 2022. Dr. Melia says some have stayed for more than 3 months.
If they're with me for 10 days, there's a good chance that there is no resources available for them. And so those are the patients that we know are going to be with us for long periods of time, because there are no resources in the state for many of these patients at all, or very few.
Scarce, even in the ED, where extra beds are on the floor.
Is it safe to say that the conditions that we see the images of are a manifestation of the bottleneck of the lack of other services that these kids need?
Yeah, 100%, 100%.
So what is available for kids right now? Maine has 21 children's residential care facilities, a total of 230 beds. They are places kids can get 24/7 intensive treatment outside of their homes. But the state says those are meant to be short-term options, usually about 3 to 6 months. We asked the Department of Health and Human Services for an interview, but they did not make anyone available. Dr. Melia says in these emergency departments, the kids and the staff are essentially treading water.
When I say it's not a therapeutic environment, a lot of that is because of the distance and of the individual, of the patients. You want everyone to have their own separate space, their own safe space. You want them to feel safe in order for them to get better. It's not the way the system is designed, but until somebody else is going to be able to take care of these children, I have to take care of the children.
Spaces like a long-term psychiatric residential treatment facility. Maine does not have any, so it contracts with facilities out of state, forcing parents like this mother to make the difficult choice. Her son is now in Tennessee.
If anything, this is the biggest act of love. This is to say, I love you so much that I am willing to navigate this broken failure. That is not my failure. That is not your failure. I'm willing to navigate the muddy waters to find a way to get you the treatment that you need to keep you safe, because I love you so much and I believe that you are deserving of the treatment that you need to grow as a person. At least there he has access to therapeutic interventions that he so desperately needs. He has access to psychiatry, med management, nursing. Peers like him, freedom of movement, his own clothing. Things he can't get in the back of an ER here when the state fails to make resources available for him.
DHHS staff say that sending kids out of state costs Maine $300,000 a year, your taxpayer dollars. So what is the state doing to change this situation? A DHHS spokesperson says the agency's working to develop one of those PRTFs here in Maine. But first, they're trying to decrease the number of kids who actually need that out-of-home care by intervening earlier in the community. Now, the state also requires a family transition specialist to follow up with a child and their family for 6 months after they've left one of those short facilities in order to help them transition successfully. Now, also included in the governor's budget is a plan to develop a standardized referral process for kids who need this residential treatment. That DHHS spokesperson says there's also a new no eject, no reject policy. It requires any provider that wants to discharge, stop serving, or reject a child at their facility to get written approval from DHHS first. The state will report its progress on that PRTF to the legislature in January.